surgical oncology, medical oncology, radiation oncology is the three main groups of treatment modalities of any cancer. When you come to the surgical oncology, that is removal of the cancer by means of operation is surgical oncology. How you remove? Now it used to be only open surgeries. Now you have laparoscopic surgery, robo-assisted surgery, like in deep pelvic tumors. Like the surgeons, when the tumor is situated deep into the pelvis, surgeon's hand cannot go 360 degree to turn his hand. That much only the surgeon's hand can move. But with robotic surgery, they are able to do much more heroic surgeries, which was not possible those days. Now it's been possible. Surgical oncology is grown so beautifully. Coming to the medical oncology, yes, we had, of course, you very well know platinum was a real breakthrough in the medical oncology. But after that, so many more has happened, immunotherapy, targeted therapy. So the growth in medical oncology, which all we thought we couldn't treat those days, now we are able to do that. Even in a little metastatic disease, when we call stage 4 disease. Now, whenever there is an oligometastasis, we still attempt cure for those patients. It's not like now stage 4, we can't do anything, it's only palliative. It's not anymore like that. It depends upon what cancer, how many metastasis. Oligo means less number of metastasis. A patient who's having one single metastasis in the brain, even though it is stage 4, we can still do a lot more for this patient than what we were doing before. With my department, that is radiation oncology, from cobalt, we are now into the era of proton. The evolution has been simply superb, and I have been one of the lucky person who have seen those days treatment and the present day treatment, and I'm really happy I'm able to treat things. From cobalt, we moved on to linear accelerator. From 2D technology, we moved to 3D technology, intensity modulated radiotherapy, then image guided radiotherapy. Then we moved into the radiosurgery, like cyberknife. From gamma knife, we moved on to cyberknife, and then now to the even more beautiful technology like proton technology. So the journey has been very beautiful. And I mentioned about one single metastasis. I recently had a patient who's a young man. He was about 37 years old, and he had a bad parotid tumor. It was a little locally advanced, and wonderful surgery was done for him, and we finished the adjuvant treatment with chemotherapy, radiotherapy. Very, very rare presentation. He presented with a tiny, small, single metastasis in the brain. We went ahead, we operated, we did a proton therapy, and patient is back to normal, doing all his day-to-day work. In the past, if this was the scenario, this wouldn't have been a possibility. Now it is a possibility. That is what I'm trying to tell. Recurrence, re-radiation. How many? We didn't even think of doing radiation in the past, re-radiation in the past, because once tissues are irradiated, they don't forget the radiation. So re-radiation was not a possibility those days. Now re-radiation is very much possible. We are doing so many. The technology is available. Cyberknife is one such equipment. Proton is one such equipment where we can think of re-radiation. And liver, we never even thought. Moving organ. Liver is a moving organ, and radiation is a static beam of rays which comes. So in the moving organ, we cannot use something which is static. I hope I am clear. See, something is static. So we found that is when the cyberknife came, where with this robotic, the linear accelerator is attached to a robotic arm, and it can see the tumor moving. It can move along, automatically corrects according to the movement of the tumor. So that is a beautiful technology where we can make use of. Real-time imaging with the proton therapy also made it possible to treat such precision. So precise a technique is, we don't do anything outside that field. Like if the tumor is this, we treat only that. The rest of the normal tissue will be completely protected. So these are amazing technologies which has made oncology. It is not anymore like it's a killer disease. I wouldn't say anything like that. Even with a little advanced in certain cases, it's really, really being beneficial.